I chaired a session where Dr. Rakesh Popat and Dr. Barry Quinn spoke. It was very much focused on patients who have myeloma, and it was a lovely presentation. We heard how treatment for myeloma is changing. So patients are living for longer, but probably with more uncertainty because they're having more lines of treatment, and they don't necessarily know when that treatment's going to end for them. So we looked at that with Dr. Popat, and then Barry spoke more about supportive care needs for patients and how we, all of us, interact better with patients really, and communicate well with them and focus on the patient's needs, so that we can see the situation through the patient's eyes, and can really, I suppose one of the most inspiring things Barry spoke about was allowing patients to set the agenda and the conversation. So what we often do in clinics, for example, is it's very much around our own agenda, where we've got a checklist of things we want to address, and we should always really step back and think about letting the patient drive that agenda. Because then it will be more engaging probably, and it would be probably it would be of more benefits to the patients, and also I think it would be more satisfying for us to have those kinds of interactions. I think the busier we get really, the more factory-like we can become, so patients feel they're being processed and the individual with cancer can get lost. So I think when we're looking at services, we just need to take a step back and think about how do we ensure the person's being treated as an individual here. I work in a chemotherapy unit, and nationally I've seen a problem where the focus is on giving drugs to people safely, which is very important, but there's a person there who's frightened and have got their own needs that need addressing. And it's more rewarding, certainly for nurses, to be able to interact with patients and support them better. So it's balancing the technical care with the psychosocial type care.